Hello students, I welcome you all to Obstetrics and Gynecology with Mackler. So from this module onwards, we are going to deal about contraception. So contraception is also a very important topic, right? Why? Because is that in every competitive examination, at least one question will be from contraception, either in terms of image-based question, or it could be a clinical scenario-based question, or definitely one question will be from missed pills. So while discussing about contraception in detail, we'll be dealing with the previous year questions as well, right? So we are going to discuss contraceptions in various segments and fractions, and this is going to help you in recollecting all the important points for your examination. Clear? So let's start with contraception. So to begin with, what do you mean by contraception? So contraception is basically a method or a system. So contraception is basically a method or a system which is going to allow the couple to have coitus or intercourse. But despite of having the coitus or the intercourse, this contraceptive method is going to provide advantage to the couple of preventing any conception or pregnancy. Is that clear? See, contraception is basically a method or system which is going to allow the couple to have coitus or intercourse. But then it is also going to provide the advantage of preventing pregnancy or conception. So it allows the couple to have coitus, and at the same time it is going to prevent the pregnancy despite having coitus. So this is termed as contraceptive method or contraceptive system. So this is the ideal definition of contraception. Now the second question. Contraception is primarily a temporary based method or a permanent based method. So contraception can be a temporary as well as a permanent method as well. So when are you going to call a contraception as a temporary method, and when are you going to call a contraceptive method as a permanent method? So you are going to call a contraceptive method, a particular contraceptive method, as temporary when the effect of preventing the pregnancy by that particular contraceptive agent is going to last when the couple is going to use the method. A couple is using a particular contraceptive method, and that contraceptive method is preventing the pregnancy unless and until the couple is using that particular method. But if the couple is going to stop it, after stopping that particular contraceptive method, the fertility is going to return back. Is that clear? So basically, you can term this temporary contraceptive method as return of fertility, right? So unless and until the couple is going to use this particular method, they are prevented from pregnancy. But as soon as they are going to stop this method, after few weeks, the fertility is going to resume, right? So that is called as the temporary method. So as you can see here in this definition, when the effect of preventing the pregnancy lasts while the couple uses the method, but the fertility is going to return immediately or within a few months of discontinuation. So as soon as the couple is going to discontinue that particular contraceptive method, within a week or so, the fertility is going to be resumed or it is going to return. So this particular contraceptive can be termed as a temporary contraceptive method. So now, when are you going to call a particular contraceptive method as permanent contraceptive method? So all the surgical management, all the surgical contraception are definitely permanent contraceptive method. It's very clear, right? So what are the surgical contraceptive methods you know? The two most important thing, like everyone know, it is a very layman term, anyone can tell this term, right? So tubectomy in women and vasectomy in male. So tubectomy is female sterilization and vasectomy is male surgical sterilization. So both of these are surgical methods of sterilization which comes under surgical contraception. And whichever method you're going to select it for the particular couple, it should be effective for the couple to prevent the pregnancy despite of having the coitus, and at the same time it has to be very safe to use. Is that clear? Yes. So until now we have discussed about what is contraception, the definition of contraception, and the temporary and the permanent methods of contraception. Right. Now we are starting with what are the methods of contraception. So if you're going to start with the methods of contraception, there are several different methods of contraception, right? So we'll be dealing with in detail. In the subsequent modules, each one will be discussed in detail. But as of now, this is a general introduction of contraception where we are going to just discuss what are the methods are actually available with us. Okay, so the first method is natural methods of contraception. So as the term signifies, naturally you are going to attain contraceptive effect. How are you going to attain this contraceptive effect? So abstinence during the fertile phase of the menstrual cycle, right? Abstinence means what? You are going to refrain. You are going to basically ask the couple to refrain from any coitus or intercourse during the fertile phase of the menstrual cycle. The couple should actually abstain themselves from the coitus or intercourse. So in a very layman term, you're going to ask the couple that please don't have any coitus or intercourse during the fertile phase of the menstrual cycle. So if you're going to avoid coitus or intercourse during the fertile phase of the menstrual cycle, then therefore the chances of conception is going to decrease. So this is a natural method, right? So because why it is a natural method? Because you're going to ask the couple that please don't have any coitus during this fertile phase of the menstrual cycle. So the couple is actually not having coitus during one particular time of the menstrual cycle. So this is a natural, right? So this is a natural method. So this is called as the natural method of contraception. So first thing is that you're going to ask the couple to refrain from having any coitus during the fertile phase of the menstrual cycle. The second method could be withdrawal or coitus interruptus. So what do you mean by withdrawal or coitus interruptus? So coitus means we all know it is intercourse. Interruptus means you're going to intervene. So it is basically you're going to prevent the male partner from depositing the semen inside the vaginal canal, right? So if you're going to prevent the ejaculation of the semen inside the vaginal canal, then therefore the conception is not going to happen, because for conception to happen, for fertilization to happen, the sperm has to reach the ovum. So once the sperm itself is not deposited in the vaginal canal, then therefore the couple can never be pregnant, right? So that is called as coitus interruptus. That is, the couple is going to have the coitus, but then they're going to prevent the semen to be ejaculated inside the vaginal canal. So basically you're going to prevent the ejaculation of semen inside the vaginal canal. So this is also a natural method because the couple is going to be very conscious and they are going to interrupt the coitus, right? And the third most important natural method of contraception is breastfeeding. Why breastfeeding? Because breastfeeding, we also know that the hormone which is very important for production of milk is prolactin, and prolactin is going to have a negative feedback, right? So because of this negative feedback, definitely there is no menstruation in a female. So therefore a contraceptive method can be attained naturally by breastfeeding. So breastfeeding can provide contraception ideally for a period of about 6 months postpartum. So after the delivery of the child, or for a period of about 6 months, this breastfeeding in itself is going to provide contraceptive effect to the female. So all these are the natural methods of contraception. Fine. So this method will be dealt in detail in the subsequent modules, right? Okay. So now the second most important method is barrier contraceptives. What do you mean by barrier contraceptive? What do you mean by barrier? Barrier means something which is shielding, right? Barrier is a shield, right? Very simple term. Okay. So what do you mean by barrier contraceptive? Barrier contraceptive is nothing but you're going to provide a shield, and this shield is going to prevent the fertilization of the sperm and the ovum. This barrier is going to stand as a shield and it is going to prevent the fertilization. That's all. It's very simple. So this could be done by either with means of some barrier agents such as condoms by male, use of spermicidal agents. What are spermicidal agents? Spermicidal agents are basically those agents which are going to decrease the motility and the viability of the sperms, and use of certain contraception, certain barrier contraception such as diaphragm, male condom, female condom, 2-day sponge, and everything will come under this barrier contraceptions. Not only that, this certain agents, certain barrier contraceptive agents are going to have some hormones which are going to basically alter the cervical mucus, and this is going to prevent the entry of these sperms into the cervical canal. So these spermicidal agents which are actually contained in this contraceptive, barrier contraceptive, this permissible agent is going to prevent the entry of sperms into the cervical canal. Why? Because even before entering the cervical canal, this permissible agent is going to decrease the viability and the motility of the viable sperms. Right? So basically barrier contraception is a shield which is going to prevent the fertilization. So use of male condom, female condom. So all these condoms are going to prevent the interaction of the sperm and the ovum. So once the sperm and ovum is not going to interact, then definitely no fertilization is going to happen. Is that clear? Yes, but the only most important thing here is that all these barrier contraceptions are coitus dependent, right? It is coitus dependent. For the act of coitus, these barrier contraception has to be used, right? Unlike the natural method of contraception, barrier contraceptions are those agents which has to be dependent upon before having coitus or intercourse, right? But there are certain exceptions in these barrier contraceptions which are basically coitus independent, which we'll be dealing with in subsequent modules. Clear? Yes. Now the third most important method is intrauterine contraceptive devices. So basically the term itself suggests that a device is going to be put inside the uterus. Intrauterine means inside the uterine cavity. A device is going to be put inside, and this device is going to provide a contraceptive effect. How it is going to provide? Because this device is going to have some particular hormones, and this hormone is going to provide contraceptive effect, right? This hormone is going to be released subsequently on each particular day, and this hormone is going to prevent the contraception, right? So once this device is going to be inserted inside the uterine cavity, this has to be removed only when the female is going to desire pregnancy, right? So this is also a reversible method of contraception. Clear? Yes. And the fourth important method is suppression of spermatogenesis. Suppression of spermatogenesis. What is spermatogenesis? It is actually the process of formation of sperms. So you are going to suppress the process of spermatogenesis itself. This can be achieved with the help of drugs or through surgical method of contraception such as vasectomy. And suppression of ovulation with hormones, right? Hormonal contraceptive agents which are available as oral contraceptive pills. So this pills which contains hormones, active hormones, this hormones is going to provide contraceptive effect, right? And then interceptive agents. What are interceptive agents? Interceptive agents are those agents which are going to interfere with the fertilization, ovulation, and then implantation. So basically it is going to interfere. So when these interceptive agents are of great importance, it is of importance after having coitus. So immediately after having the coitus, if the couple doesn't want to desire pregnancy, right? So as a method of emergency contraception, these interceptive agents can be used to prevent the fertilization, and this can also prevent the implantation, right? And the last but not the least, surgical method of sterilization, that is tubectomy in females and vasectomy in males. So all these are the methods of contraceptions, right? Okay. This will be dealt in great detail in subsequent modules where each particular method of contraception will be dealt. Clear? Yes. Now, so when discussing about contraception, well, you're going to select a contraceptive agent. There are several prevailing factors which has to be taken into consideration before prescribing any particular contraceptive agent to a couple. So the age, the marital status of the couples, and therefore the contraindications, the indications, the comorbidities, and the histories which are collected from the couple has to be taken into consideration before prescribing any particular contraceptive agent to the couple. And also, an ideal contraceptive method should be very effective, it has to be safe, it has to be long lasting in nature, and it has to be coitus independent, right? What is coitus independent? Irrespective of having coitus or not, this contraceptive effect has to be present throughout the day or throughout the time the patient is desiring contraception. Let's say, for example, a patient is coming to you, right? And this couple is desiring contraceptive effect for the next 6 months. So the contraceptive agent which you are going to prescribe to that couple should have a nature that it has to provide contraception irrespective of the couple is going to have coitus or not. So every time the contraceptive effect has to be present in the couple. So such contraceptive agent has to be an ideal contraceptive method. So it has to be effective, long lasting, safe, coitus independent, and definitely it has to be a reversible method, right? Because sooner or later the couple is going to desire pregnancy, and once the couple is desiring pregnancy, the contraception has to be discontinued. Only then the couple can actually get conceived later on. So it has to be a reversible method of contraception where the fertility has to be returned for that particular couple. Clear? Now, contraceptives can also be classified into long acting, medium acting, and short acting agents. So they are basically classified into long, medium, and short based on how long the effect is going to be produced in the couple. So long acting agents are those which has to be renewed every single 3 months or say, right? It is very clear for you. See, long acting agents are those agents which is going to provide the effect of contraception for a period of about 3 months or say, but after 3 months this long acting method has to be renewed upon. Whereas medium acting are those contraceptive agents which has to be renewed after every week or month say, right? So every 3 months is a long period and every week is a medium period, and if you have to change the contraceptive method, or if you're going to have coitus, you have to prevent the contraception. If you're going to have the coitus, you have to prevent the conception. And how are you going to do that? If you're going to select a method such as a barrier contraception, such as a condom or any spermicidal agents, and these agents have to be renewed every single day, right? A single condom cannot be used for subsequent days. Like, let's say for example, for a particular week a condom cannot be used. This condom has to be changed every single day. So some contraception has to be changed every day or every 2 days or every 24 hours. So those are basically short acting contraceptive agents. But there are certain contraceptive agents which has to be renewed every week or every month. So those are the medium acting contraceptive agent. But then there are also certain contraceptive agent which has to be renewed every 3 months or every 6 months. So those are long acting contraceptive agent. So based on how long the effect of contraception is being provided to the couple, the contraceptive agents can be classified into long acting, medium acting, and short acting contraceptive agents. Right? So what comes under the long acting contraceptive agents? So those are the 3 monthly oral tablets, the 3 monthly IM injections, intramuscular injections, which are basically hormonal injection which is going to provide contraceptive effect, implants which are basically implanted under the skin of the female which is going to release the hormone, intrauterine contraceptive devices, and the surgical methods, right? So these are long acting method because the effect is going to be there in the female for, let's say, 6 months, 3 months, or 12 months or say. But then surgical method of contraception is a permanent method of contraception, but then it is also a long acting contraception. Is that clear? Yes. So medium acting agents are those which has to be renewed every weekly or every monthly, because certain injections are given monthly, right? So you ask a patient to come today, you're going to give an injection, hormonal injection, and you ask the patient to leave today and come on the next month on the same date to have the injection. So every monthly the injection has to be given to that female to have a contraceptive effect in her. So those are the medium acting contraceptive agent. But then the short acting agents are those agents which has to be dependent upon having coitus. Let's say for example a couple is going to have coitus now. So before having coitus, for contraceptive effect the couple is going to wear the condom. So they are relied upon the condom in order to prevent the conception. So this condom has to be changed every single day because the efficacy of the condom is going to decrease once it is going to be repeated for every single day. So therefore it has to be changed every single time when the couple is going to have coitus. So therefore those are short acting contraceptive agents because condoms cannot be used for a longer period of time. It has to be changed for every single act of coitus. So all these condoms, barrier methods, postcoital interceptive agents, these daily pills, and the skin patches, intradermal patches, all these are short acting contraceptive agents. Is that clear? So based on how long the effect of contraception is going to be present in the couple, they are divided into long, medium, and short acting contraceptive agents. So we have discussed about all the methods, important methods, and the classification of contraception. But then one more important thing which needs to be taken into consideration at this particular point of time is the failure rate of contraception. Because we cannot be for sure that all these methods of contraception is going to provide 100% safe to the couple. It is not like that. The failure rates are also anticipated with every single method of contraception. So there are very particular studies which are done to determine the failure rates of contraception, right? We have particular index with respect to it also. So all those things will be discussed at the end of contraception. Only after understanding what are the different methods of contraception and how they act, we will come back to the failure rates of contraception. Only then it will be very easy for you to understand, right? So in this module, we are winding up with the definition of contraception, what are the temporary and permanent contraception, what are the methods of contraception, and the classification of contraception. So let's meet in the next subsequent module where we'll be discussing in detail about the natural methods of contraception. Is that clear? Yes. Until then, please keep studying. If you have any doubt, please write to us in the Gmail handle. We'll reply to you as early as possible. And please subscribe to Mackler YouTube handle for daily